Welcome to another episode of the Urban Wall Street Project. I'm your host, Earl Christian III, of course, and today I'm coming to you on location from Laurel, Maryland at Winfrey Dental Aesthetics Dental Spa. One of my colleagues, HU's own, of course, Dr. Tiffanie Winfrey. Hey, Tiff!
Hey, Earl, what's up?
Oh, it's a beautiful thing. First, I have to say I'm so proud of you, Tiffanie.
Thank you.
I mean, Howard's always representing, and I see you doing your thing. Dentistry, and you're the first dentist that I've had on the show, and it was very important for me to come down and spotlight it because so many of our kids following us and youth are going to be dentists or they have different dreams, and I want to be able to provide them with information from professionals who are doing it. They're not working in other places, but you have your own office, your own practice, and that's a beautiful thing because ownership is king, and y'all know how I talk about it. Ownership is king. So I want to talk about Tiffanie Winfrey, DDS. When did you know you wanted to become a dentist?
I think I knew when I was in junior high school. I used to tell all my friends I was going to be a dentist. And I think the more I kept telling myself, the more I kept believing myself, and I just did it.
Now, was there any particular epiphany or revelation you had? Did you lose a tooth or something that made you realize, I want to do this?
Well, I spent many years in a dental office as far as having braces. So I thought I wanted to be an orthodontist, but when I got to know more about the field and know about other things involved in dentistry, then I decided to become a general dentist so that I can do a little bit of everything. Okay.
Now, so you go to undergrad.
Yes.
Now, did you start off majoring in dentistry, or is there a major or minor in dentistry, or what's the prerequisites for dentistry?
No, natural sciences are your prerequisites. I was a chemistry major. I started off as a chemistry major, but I ended up as a sociology major, but I kept chemistry and math as my minor, and I just took whatever classes that I didn't take in undergrad. I took them after I graduated so that I could prepare myself for the dental admittance exam, which is the exam you take to get into dental school.
Okay. Now, very important, a lot of individuals, we have kids studying in science and math. I would assume it's very important in any medical field. And I've listened to President Obama, and he says the next 4 to 5 years, many of the job occupations are going to be math and science related. How challenging in the science field are the prerequisites to someone who wants to become a dentist?
Well, it can be very challenging, but you just have to have good study habits, which can be hard when you go to Howard. But you just have to have good study habits and just motivate yourself to stay focused so that you can achieve that ultimate goal.
Okay. Was there a tough course? Can you remember one of your toughest courses as you prepared for, in the undergraduate, as you prepared for, the graduate level?
Just general chemistry. Organic chemistry was easier for me. General chemistry, I guess that was my freshman year. Howard, being at Howard, it was new, so you had a lot of distractions. But most things that you really want are not going to come by easy anyway. So you just have to really work hard. And in the church that I grew up at home in Memphis, Tennessee, the motto was extra effort wins. So I just had to give that extra effort.
Okay, so now, you do your thing, you make it through undergrad, and it's time for graduate school. What was the process like, transitioning from undergraduate to graduate school?
Well, I didn't go straight into dental school. I took 2 years off. I felt that I needed a break. So I took 2 years off, and that also gave me time to take any other courses that I needed, the prerequisites to take the entrance exam. And then, and I worked at NIH, so that helped a lot too. But yeah, just taking those courses and getting my mind prepared for the next 4 years, which I knew were not going to be easy.
Okay, so now someone who's once they aspire to be a dentist, if you had to give them, 2 or 3 sound pieces of, academic advice or suggestions so they really can maximize their time, what would they be?
I would definitely say to meet a dentist and call the office and ask if you can come in and shadow. Go to dental school, talk to dental students that are there just so you can get an idea of what it's like to be in dental school, what to expect.
Okay, so now you go to dental school, you're in graduate, you get to dental school, and you do that. Were you nervous when your first patient? Because I know when you're in medical school, you have to do clinicals. Tell me about the experience. I remember being at Howard, and we had student insurance. You didn't have insurance, and I had to go to the dentist. And the dentist, they sent me to Howard Dental School, and a dental student worked on my tooth, and my tooth was still here, so I guess he did a pretty good job. What was that first experience with that first mouth that you had to look into?
Of course, nervousness, because it's nothing like doing something you've never done before, especially when you're dealing with someone's life
right.
in some sort of fashion. But the more you do it, the easier it gets. So it's very good to keep seeing patients. We had to see so many patients and do so many different procedures to get credit that went towards graduation. But the more patients you saw, the more patients we saw, we were always supervised. We always had instructors over us, and all of the instructors are really good. So that really helps. I can't really remember the very first patient I had, but I just know I was scared.
Right.
I mean, it was intimidating, but I got over it.
Right.
And kept it moving.
That's just a beautiful thing. Now, support. You know, do you come from a family of dentists or estheticians?
No, I don't. My parents were not dentists. We had close family friends that were dentists. So while I was in dental school, one close friend in particular of my parents allowed me to work in his office. You know, so I learned a whole lot, especially on the business side, from working with him.
Oh, okay. So the support. Now, your parents, when you decided I want to become a dentist, did you always have that full-on support from your parents?
I sure did.
That's a beautiful thing. And how important do you think it is that individuals, whether it's a parent, uncle, aunt, mentor, teacher, there's someone that really is a foundation and someone that really gives that young person support? How important is that?
It's very important because it's not easy. It's not easy at all. There are nights when you don't sleep. There are nights when you may get just 2 hours of sleep. You may even decide you don't even want to eat anything because you're so into studying, or you're trying to prepare for 3 tests the next day. You don't get to choose your classes like you do in undergrad. Your classes are given to you, and you have to take them. And you have to juggle that with getting patients, hustling and getting patients. You might have to go out on the street and get a patient and bring them in.
Really?
Yes. So it's not easy, so the more support, the better.
So now I just learned something. I just learned something new. So because a lot of times in undergraduate and graduate school, you pretty much take with the classes that you want. So graduate in dental school, so in undergrad you choose it, but now you get to dental school and they tell you what classes to take. Oh, that's a serious situation.
It's very structured.
So the background, so the foundation that has to be laid if you want to become a dentist is intense.
Exactly.
Beautiful. Yep. So you already know what it is. We're going to go look at some things. You're going to see the dental office. We're going to continue talking with Dr. Winfrey.
Big dreams and good grades aren't enough to get into college. There are actual steps you need to take. Finding someone who can help is the first and most important. For the next steps, go to knowhowtogo.org.
So now we're in the dentist operatory, and it's called the operatory because this is where they operate on your mouth, get your face sexy, get your teeth back on point. So a lot of times people get to the dentist later than sooner. But hopefully we hear some information that doesn't scare you, because a lot of folks are scared. But the dentist really, it's not a scary place to be. It's a beautiful place to be because your smile means a lot. And Dr. Winfrey's going to let us know some of the main procedures that she comes through her doors, or the people that come to the doors want to have taken care of. So what would you say the top 3 or top 4, Dr. Winfrey?
I'd definitely say tooth whitening.
Tooth whitening.
Tooth whitening. We do in-office teeth whitening with Zoom. Zoom is a product that allows you to get your teeth whitened within an hour in the office. So people don't want to always wait 2 weeks before they see their teeth white.
Right.
Everybody's not a candidate for Zoom, so the next option would be veneers. Veneers is a way of changing the color and the shape of a tooth. and giving you that Hollywood smile, like you, Earl.
That's what I'm talking about. Okay.
And the last, I can say, the other procedure that most people come in here for is to replace a missing tooth. And the best way that we try to encourage patients to replace missing teeth is with implants. And implants are a titanium post that replaces the missing tooth alone. You don't touch any other teeth. You just go right to where the tooth is missing, and the implant is placed. I don't do them. I restore them, meaning I make them look like teeth. And the last procedure that's popular here in the office is straightening of the teeth. And I do Invisalign, which is the alternative to braces. So most patients around our age, 40s, don't want to walk around with brackets and wires on their teeth.
Right.
So the aligners, which are clear aligners that are placed over the teeth, that every 2 weeks you're switching to another aligner, which straightens the teeth and puts them in a different position, eventually getting you to that straight smile.
Oh, okay. Now I know there's definitely some unpopular ones, and I've been a candidate of a couple, and that would be a root canal. Now let's talk about a root canal, because people hear it, it's very scary, or people don't know what a root canal is, how long it takes, how many procedures, but what leads to and is the ultimate reason a root canal will be necessary?
The ultimate reason a person would need a root canal is a cavity. And if a cavity does not get treated early enough, it only gets bigger. If it gets bigger, it can get deeper. It gets deeper, it gets close to the nerve. And when it gets close to the nerve, the only way to clean out the cavity is to sometimes take the nerve out of the tooth. And that's what a root canal is. Root canals get bad reps, but root canals, I've had one, and it's the most pleasant experience I ever had. As long as you're numb and you don't feel anything, and you let the dentist know, hey, can you give me a little more juice?
Okay.
Get them numbed up.
Now, why do you think? What do you think people allow their teeth to get to the stage of a root canal? I mean, because a root canal, I mean, so you're talking about to the nerve, and I'm sure you can look at some pictures.
Yes.
It's not an overnight process. You don't just have a cavity and then 2 weeks later it's at the nerve. It takes time for it to decay or to get to that procedure. So, what do you think is the reason that people just shy away from taking care of their teeth sooner than later?
Fear. Fear is the biggest concern of everyone. They hear horror stories or hear bad stories from someone else, so that makes them not want to go. But they don't realize the longer they stay away, the more likely something is going on in their mouth that they're not aware of, and it may not always cause pain. So we try to encourage preventive measures coming in every 6 months, x-rays to be taken. Just because it doesn't hurt doesn't mean nothing is happening in the mouth. But poor oral hygiene, where someone doesn't brush and floss on a regular basis, and like I said, you can have a cavity and never know. You could have a deep cavity and never know. You could have a cavity that needs a root canal, a tooth that needs a root canal, and it doesn't hurt you. But it's not until you show up to the dental office, maybe you finally get the nerve to show up, and you come and we take an x-ray and we're like, this is a deep cavity, and it may end up needing a root canal. And the biggest thing is, the longer you wait, the more expensive it can get too.
And that's key.
Exactly.
Because it's sooner than later. The sooner you take care of it, the least of the cost. And that's almost with anything, whether it's a car, your health. Now I want to talk about braces, because I see a lot of young kids. I work with children with my Young Producers program, and a lot of young kids, I see their teeth, and you can tell, okay, they're a candidate for braces, or they're going to need braces. Is there an age at when braces cannot be applied, or their age that a child must be before they can have braces?
Braces can be placed on a child as young as 8.
Okay.
It just depends on what's going on in the mouth. Sometimes early prevention needs to be accomplished in order for the permanent teeth to come in properly. And sometimes if you start them early in some type of appliance therapy, then they may not have to go into braces when they get older.
Oh, okay. Now, before I want to go to saying something, I'm looking at something over here on the screen. And what is it that I'm seeing right now, Dr. Winfrey?
You're seeing implants. You're seeing a video of someone who's missing some front teeth. We call them anterior teeth. They're missing front teeth, and instead of them wanting to wear denture, which is something that your grandparents would wear, they take them out at night and put them on the side of the nightstand. This is something you don't have to take in and out of your mouth. And the implant is a titanium post. Like I said, it's fused, becomes a part of you. 99% of implants never need to be replaced.
Okay.
Never need to be replaced if they're placed properly. Never need to be replaced. And a crown is placed over that implant after it heals and fuses to the jawbone.
Now, would you suggest implanting over a bridge or?
Implant is the best way to go.
The best way to go.
The best way to go. It stays with you.
Now let's talk about a bridge because brother's been a candidate of a few things. Too much candy in life. Kids, stay away from the candy and the sweets. But I used to eat a lot. But I don't want to digress. I had a bridge and it seemed pretty cool. Would you suggest? Is there ever a time you think a bridge might be a good option for a person?
Well, if a person cannot afford an implant, then a bridge is the second option.
Well, shoot, I could have afforded it. I guess I just didn't have the time.
There you go.
But you have options. That's a beautiful situation. Now, I also know the temporary restorations. Temporary restorations. What exactly are temporary restorations?
They're restorations that are not made of, like, for instance, crowns are made of porcelain, all ceramic, porcelain fused to metal. It has to be made. Sometimes it can be made in the office. Sometimes it can be made in the lab. But the temporary restoration is something that holds you until you can get that permanent one put in your mouth. It pretty much looks like a tooth. We try to make it look as natural as possible, but it's made of acrylic or a material that's not as strong as the final restoration.
Okay. So before we finish up in this section, the operatory, one final word of suggestion to people who think that they need to see a dentist? Because if you think you need to see a dentist, do you probably need to see one?
Yes.
So the final word you want to say to them?
Don't wait till it hurts. Go and see a dentist on a regular basis. It will save you. It will save your life, because a lot of things that happen in your mouth lead to the rest of your body. Healthy mouth, healthy body.
Beautiful thing. Now, Dr. Winfrey, I'm looking at this chair over here, and I've sat in chairs in the dentist's office, but this chair seems to be doing something a little bit different. Am I getting a massage?
Yes. That is part of our spa experience, because people come here and they're afraid, so we try to do as much as we possibly can to make them, to calm them down. In addition to the chair, we also offer aromatherapy neck pillows. We have movie glasses that we show movies on. We have a huge movie list that I brought from home. All my movies I don't watch anymore, and we bring them here and I buy movies, new movies, but it allows patients to take their mind off of the drill, the sound of the noise, all of that. And some people even fall asleep, which is a big compliment.
That's a beautiful thing. I love it. I think I'm going to have to come on down here and get me a massage and an implant.
Come on.
There it is.
Love to have you.
Winfrey Aesthetics, Urban Wall Street. It's a beautiful thing.
Listen, I know you're upset, but it was just one date. And dating's like the stock market. There's ups and downs and ups and so always buy low.
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who would love to put up with you.
What's going on? It's your boy Earl Christian III, producer of the Urban Wall Street Project. We got a lot of people out here that want to be producers, want to be writers. Well, we're looking for field correspondents, no matter what part of the city you're in, what part of the country you're in. If you want to be a Skype guest, we're doing a lot of positive things. So if you think you're ready to get in this production game, you think you want to be a correspondent, reach out to the Urban Wall Street Project at urbanwallstreet.tv or email us at info@urbanwallstreet.tv. Let's see if you can make it happen. Are you the next producer? Let me know. So we've heard the history, and we've learned some of the history behind becoming a dentist, the road to becoming a dentist. And we've gone to the operatory, and we see how things happen, where it happens, and some of the procedures that happen in a dentist's office. But at the end of the day, ownership is king. And in the Urban Wall Street Project, it's about ownership. And this is Dr. Winfrey's dental office. And there's a lot that comes with it. So she's going to talk about now in the final stages, the steps, the procedures, the obstacles, going into maintaining and having your own dental spa and keeping it alive and keeping your customers happy. So I know this is the meat and potatoes now. This is the business of having a dentist office. So let's talk about some of the, I guess, I won't say obstacles, but obstacles because good or bad, and hurdles that you accomplished and overcame to own your own dentist spa and office.
Well, coming out of dental school, you really don't think about owning your own practice. At least I didn't think about it. I worked for different offices. I saw how they ran the office. Some of them I liked and some of them I didn't, and I moved on and definitely worked in different practices in different parts of the area. Bethesda, Germantown, Oxon Hill, Landover. So it was a big experience for me, an eye-opener, and I finally got to that point where I decided that I want to do this for myself. I want to do something different, and only way it could be done, it was for me to do it myself.
Okay, now so first steps, I love it. This is like now it's dental office ownership 101. First step.
First step,
own your dental office.
Securing a loan.
Securing a loan.
Securing a loan, making sure you have good credit so that you can secure that loan, and forming a business plan so that you can have your map of what you're going to do, how many days you're going to be open, the hours you're going to be open based on where you're located. I'm in Laurel. A lot of people work in DC, so some people want to either come early in the morning, especially if they don't work close to where they live, or they want to come late in the evening. So I had set up days where I may stay open to 7. I have 2 days a week where I stay open to 7, so people have time to leave work and come to the dentist. Some people, we open at 8 on 2 other days, so some people want to come at 8 so they can go right on to work when they're done. So those are things that you definitely have to take into consideration, especially location. Location.
Right.
Initially, I was a little apprehensive about this location because there are several dental offices across the street from me, but everybody that I spoke to who've been out in this area said you have nothing to worry about. You have nothing to worry about. You have nothing to worry about. And I had nothing to worry about.
That's a beautiful
It's enough. It's enough of us out here for people to choose who they want to go to, and they choose to come to me. I welcome them.
Now, your office has been open for 5 years.
It'll be 5 years in November of 2011.
So I want to congratulate you on that, because I know that's a major milestone.
Yes, it is.
Did you think 6 years ago that you'd be sitting in the waiting area of your own dental office 5 years from now?
No, I didn't.
So what is that feeling? What does it feel like when you come through the doors and you're not, I'm a dentist, you're a dentist, and I'm not just coming to a dentist's office. When I'm looking and I see my name. What does that feel like to see your name on the door?
It feels great. It definitely feels great. My parents are deceased, so I know they would be very proud of me carrying that name.
Right, right. That's the beautiful situation. Now, staff. Can't run it on your own.
No.
It takes the team to win a championship.
Exactly.
Let's talk about your staff and how you decided the people that you were going to have working with you.
Yes. Well, I have one person at my front desk. She's considered my office manager. I have a dental assistant who sits next to me and makes sure that my room is ready and set and I'm prepared for my patients. And I have a hygienist, and my hygienist is the one that most of my new patients see, and she's the main person that does any type of teeth cleaning in the office.
Okay.
So right now that's my staff, but we're gonna grow. We're gonna get bigger. I got room for 2 more chairs and make it a total of 5 chairs. So I got room to grow.
Now, each of those chairs, so each person at your name, they have their own particular workstation where they do their capacity?
Yes, but I can't work with 1 chair. I have to have more than 1 chair so that I can see my patients, see more patients. So I like to work with at least 2 to 3 chairs just alone myself. But the hygienist tends to stick to 1, maybe 2. It just depends on the schedule for that day.
So are you ever working with 2 patients at a time?
They're staggered. So they
okay.
don't come at the same time. We try not to have them to come at the same time. It depends on the procedure, what's going to be done. I may go in and give one person anesthesia and then go in and do something else that doesn't take long, and they're done. I go back. By the time I come back in the room, that person is ready for me to start working on.
Okay. Now, back to the business. What's the most challenging, or to date, the most challenging task you've had to accomplish?
Just management. Because you're already trained to treat the mouth, but you don't really get that training in managing staff, how to manage patients that can cause trouble. So paying bills, the overhead for a dental office is not cheap. You have a lot of equipment. But at the end of the day, if you have your budget and you're sitting down and you're just taking into consideration everything that you're collecting, your collections, and you're paying your bills, then you can make it.
Now, has ownership afforded you some luxuries?
Not quite yet.
Not quite yet?
Not quite yet, because I'm the last one to get paid.
Very important. See, and that's very important for people to know. People think if you have a business, you're the first one to get paid.
No.
The owner is generally the last one that gets paid. That's why you're able to maintain it. So I'm glad that you definitely put that out there and reinforce it. It's very important. Yeah, I enjoyed this.
I did too, Earl.
You know, you're a friend, a dear friend, and I'm so proud of you again. And before I finish with you, and before I come back and get my thing taken care of, I want you to just give a final word of advice, whether from an academic perspective, whether it's from a business ownership perspective, or whether it's just from a never give up on your dream, accomplish whatever it is you set out perspective.
Never give up on your dream. If you put your mind to something that you really want to do, go for it and do it, and remember, extra effort wins.
Beautiful. My people, as always, I want to bring you the best. I want to bring you the brightest. I want to showcase individuals who are doing some amazing things, who are professionals, who have worked hard, who have been diligent, who have accomplished their goals, and they're still reaching for goals. The beautiful thing is, even when you accomplish one thing and you're professional and you're consummate, there's always that next plateau. You never really feel like you arrive. So always be mindful, be prosperous, do your diligence, study hard, ask questions, seek internships, turn over all stones, rocks, whatever needs to be. Nothing that you really want to have is going to come easy. It's not going to come overnight. But if you work hard, you maintain the faith, you keep positive people around you, you talk to the people who are doing what you want to do, without question, at some point in time, your time will come. And when your time comes and you plan to be a dentist, hopefully your name will precede dental, aesthetics, cosmetic, spa. Different situation. Urban Wall Street, Laurel, Maryland, Dr. Tiffanie Winfrey, DDS. Until next time.